Greetings. I'm Lorraine Winslow, president of the Houston, Texas chapter of LINCS Incorporated. Service is a major tenet of our organization. With May being Mental Health Awareness Month, we felt like it was critical that we focus on providing information that we feel can help you manage through this unprecedented time of COVID-19. COVID-19 has brought many challenges within our homes for parents as well as children. The Houston chapter feels it is important to partner with healthcare professionals so that we can share what is essential to coping with the new uncertainties that we are facing daily. We are presenting a series of videos that we hope you will find beneficial, helpful, and help you manage on a daily basis, just things that you're encountering that we have not experienced before. I would like to introduce Karen Marshall Hudson. She is our Vice President Program, and Karen is going to facilitate a discussion on the essential tools of coping through the many mental health aspects of COVID-19. I introduce you to Karen Marshall.
Thank you, Lorraine. I'm thrilled to be here today representing the Houston chapter of the LINCS and specifically the Health and Human Services facet. Today, I'm even more excited to introduce two of our own members who will be on our panel today, Dr. Eloise Pinckney and Dr. Tracy Kirkland. Dr. Pinckney is a retired psychotherapist, adjunct professor, and program coordinator from Richland Community College in Dallas, Texas, and the University of Dallas. She came out of retirement and is presently the science educator and medical and nursing intern and work study administrator for the Health Museum in Houston, Texas. Dr. Tracy Kirkland is a clinical assistant professor and nurse practitioner at the University of Southern California. She is also an adult and pediatric practitioner at Memorial Hermann. Welcome to you both. I'd like to first start out, though, with a disturbing topic in our community. The African Americans represent just 13% of the population, but somehow we are disproportionately represented with more than 30% of the COVID cases reported being in the African American community. Dr. Kirkland, can you kind of share a little bit with us about just exactly what the concerns are regarding health diseases and the link between COVID-19 in the African American community?
Yes, thank you very much for that introduction, and thank you for the question. Currently, we're seeing an increased amount of COVID-19 cases in the African American community, and it's postulated to be secondary to increased incidence of diabetes, hypertension, obesity, and individuals who suffer from chronic respiratory diseases like asthma and chronic obstructive pulmonary diseases. Coupled with that, you have individuals who live and reside in food deserts. You have individuals who have increased incidence of presentism, and that means that individuals who are sick with fever, with cough and congestion, they continue to go to work. They work sick, and that presents an increased risk of not only developing and acquiring the disease, but also for poor health outcomes.
So I'd like to take this question and pose it to Dr. Pinckney. So is there a difference between the stress and anxiety? And if so, how do we see it between children versus adults?
There is a difference. And we're going to go over that today. We're going to first start with stress with children. Children do not know stress. Stress is a feeling. So if you feel stress, you will provide anxiety. That's the adult. So I want to go over that so everyone understands clearly. Stress is the feeling and anxiety is the action. Now, children up to about their teens, they don't know or have the experience of stress. All they know is that their parents were stressed and they showed their anxiety with action, yelling, hitting, forbidding the child to do something. So of course, what happens? The child reacts, and then it's a back and forth situation. So what we have to do is make sure that the parent can control their anxiety, which they will display on to the child, their spouse, their parents, or anyone within their network of family.
Okay, thank you. So, as servant leaders, which both of you are, what can we do, or you all do, or recommend as healthcare providers to mitigate some of the concerns of the African American community? We've got stress from the pandemic, work-related stress, just stress with, am I keeping myself clean and my family clean? Do you have any pointers for us?
Again, Karen, that's a great question. From a medical perspective, it's really important, first of all, that individuals know the signs and symptoms related to COVID-19. Oftentimes, it's actually confused or related to symptoms of the common cold, upper respiratory symptoms, and allergies, especially this time of the year. So the first thing that we can do as servant leaders is to ensure accuracy in terms of disseminating information on signs and symptoms. Secondly, it's important to also communicate with others' concerns in terms of food insecurity, concerns with having lack of access to health care, having lack of chronic medication. For example, for the individual with diabetes and hypertension, it's important that they have at least 90-day supply of their medication.
Yes.
It's really important that they're continuing to monitor, to self-monitor their blood pressure and to do their home glucose checks to make sure that they're within the normal range. So those are some of the basic things that they can do, and not only times of a pandemic, but in general, in order to promote healthy outcomes.
As we're transitioning back to work, many of us are here in early June, part of us May. Do you have any words as healthcare practitioners on advice we could do to help us keep safe as we're returning back to work?
But the first thing that we should continue to do as we're returning to our new norm is good hand washing. And good hand washing involves washing for at least a full, 60 seconds, a full minute if possible. And it's washing in between the webs of the hand. It's washing under the nail beds, and it's using soap and warm water. Additionally, it's important that we continue to teach our children and other adults that when you cough and or sneeze, to use the sleeve of your elbow to cough in. That's very important. And then lastly, what I would like to promote, it's still important that as we're navigating back into our communities, whether it's work, whether it's the grocery store, whether it's play or interaction from, again, 6 feet, we're still social distancing, is to use your mask. And there are different types of masks. So this mask here, this is an example of a professional N95 mask, but it's important to use a mask. So this is something that even on our jobs, we have fit tests where we're fitted to ensure that we're wearing them properly. Now, Eloise has a different type of mask that she would like to talk about.
Okay, this is the mask that the average person in our community has, and they are giving them out at churches or in other areas. All right, now remember that there's a blue, if you can see, there's a darker blue and there's a light blue. The darker blue is the outside. There's a wire. Some people don't realize there's a wire on the top, but there isn't one on the bottom. So you have to make sure that the wire is on the top. You put it around your ear with the blue outside, put it over your nose, and squeeze. That's why the wire is there. It forms to your nose. Children love this. Now let's say you don't have a mask. Use a scarf. You can have a fancy scarf, tie it where it goes in the back, the knot, and every time you're out and you go into an area that you feel you need to have a mask and you might not have one available, just lift the scarf up. So there's a lot of ways that you can protect yourself during this time that hopefully you don't have to be running all around making sure that you have the proper this or the proper that. Tracy wears a medical surgical type mask, but this is the everyday mask, and you can get them anywhere, Amazon, or get them from your church, or schools are even giving them away. Now, the next thing is your gloves. Tracy, is there a certain way to take off your glove? I'll demonstrate if you tell me how.
Yes, it is important that you don your gloves correctly. So in donning your gloves, Eloise,
You take your two fingers, you put them under the glove as such. You roll them off. You put this glove in this hand. Now this hand would have a glove, correct? So you would take these two fingers, roll it off, and it makes a sack. And where are the germs? Inside the sack. That is a professional way of taking off your gloves. I've seen people trying to take a glove off and they're pulling the fingers. It'll never come off if you pull your fingers. You have to take them off correctly and you won't spread the germs because you've been out, you've touched things, and there's germs.
Those are excellent points. Thank you so much.
And Karen, as we close, we would be remiss if we didn't share that it's important to continue to pray, to meditate, we would encourage some form of yoga or mindfulness. And it's important because as we're returning, we're now hearing a new set of concerns regarding safety. Individuals who are trying to practice social distancing that's now being faced by individuals who are opposing it. So it's really important that we have a calm state of mind as we're returning to our new norm. Thank you.
I love the prayer. Can you just sort of close us out and add a little bit to that with anything else we can do to sort of keep calm during this, and especially with some of us returning back to work? Any other exercises, anything you recommend, Dr. Pinckney?
Yes, find a quiet space. It is very important for you to exercise each day. Even though we're in this time when we have to stay home, go outside, walk around. We have a Western area, a past area director that is 91 years old. She continually goes out in her backyard and walks in a large circle to get the exercise, to get her lungs open, to be able to breathe. Because we have to be careful of our senior citizens as well. And as parents, mothers, and spouse, we have to take time out for ourselves. Do something for yourself, even if it's to lock the bathroom door and draw yourself a beautiful, nice hot bath without any interruptions. Because now you're going to go back to a normal life that is not going to ever be normal again from what we used to do. We are now in a change, and it's not going to be the same. Kirk, like Tracy said, you put the mind, the body, and the soul together, and we will kick this.
Thank you both so much. You've been a wealth of information to me, to our community. I want to thank our president, Lorraine Winslow, as well as our panelists today, our Health and Human Services chairs, Diane Eigelhart, Valerie Lewis, and Dr. Melanie Dutton. Thank you so much today. Look forward to another series and our Keeping Our Minds Healthy.